To this now, the Gauteng Health Department is warning people to stop engaging in risky sexual behaviour as this increases the transmission of sexually transmitted infections and HIV infections. Now, young people are also being urged to use protection as well as exercise caution. Another concern is the number of pregnant women who presented to public healthcare facilities testing positive for syphilis. Let's talk about this now. We're joined by Program Manager for STI, PrEP and Key Populations at the Gauteng Department of Health, Nichola Lutchman. Thank you so much for your time this evening. How widespread is this problem?
Hi, good afternoon, and good afternoon to the viewers. So I apologize, we're on load shedding and it's a bit dark here. So as you've seen the data, it's in the numbers. Our STI is increasing, and we do know that it's largely attributed to behavior. It's how we have sex. We know STI is spread through sexual contact, even from the mother to the child. So like I said, it's in the numbers. We've seen an increase, and this is our outcry today to the community. Please let us try and be more or have more safer sex.
Nichola, I wonder, there's often quite a lot that is being done by yourselves and various other bodies to try and caution people out there about, the safety and the responsibilities thereof. What do you find are some of the reasons that you're hearing, particularly from young people who are not adhering to some of these safety precautions?
So it comes to numerous reasons, especially, like I mentioned, the behavior aspect.
Yeah.
We know our youth are engaging in age disparate relationships, the difference between the age groups, between the partners, unable to negotiate safer sexual practices, just feeling shy or not open talking about, hey, do you know your HIV status? Can we use a condom, or let us go to a facility and get HIV tested together, and just take those simple precautions. And I think these things hinder us from actually protecting ourselves, and this is why we're seeing this increase today.
Let's educate our viewers as well about something else that I was reading about in your statement, is the concerns around MUS, that's Maleurethritis syndrome. What are the symptoms of that?
Okay, so that's more specifically around infecting men, as it states, and it comes with a genital discharge. Once you know that you have an odd-looking genital discharge, what we're saying is, please, especially if you know that you did have unprotected sex and this came about, go to your healthcare facility, indicate to your clinician or your doctor, this is my signs and symptoms that I'm experiencing, and through that, the clinician or doctor will be able to, provide the proper antibiotics or treatment for you. In addition to that, we're saying once we treat you, we also want to treat your partner. So it's important that you bring your partner along as well for further treatment.
All right. And there's something else, of course, that I also saw an increase in the number of women that are approaching healthcare facilities to be started on PrEP. Between April and November last year, over 38,000 females aged between 15 to 49 in comparison to nearly 12,000 males. What does this tell us?
So this is actually quite encouraging, not concerning for us. Our whole intention is to reduce the HIV incidence amongst our youth, that is your 15 to 24-year-olds. We know they're the future of the country, and we're doing, I think, a fantastic job as a country as a whole, as Gauteng as a whole, in reducing this. So what it's saying is that more females in general, for any healthcare services, generally come to and access these, facilities. So they would take more control of their health. They know they want to be protected. And what Gauteng Health is actually saying, we also want men to come through and take responsibilities, be safe. We know we engage in if we're having multiple sexual partners, please let us get on PrEP. Let us utilize condoms. Let us know our HIV status. If you have any signs and symptoms, please, get treatment immediately and complete that treatment.
And there's something else that I know was a problem over the years, and I wonder, I saw it in the statement, but I wonder how much of a big problem is it, or are we seeing an improvement in that regard, women heeding the call to start antenatal care early?
Yes, definitely. That's what our information or health education goes out there with our community to say as soon as you fall pregnant, it's really important to access your antenatal care at our healthcare facilities, which is free of charge, as soon as possible. From there, we know that we've got a lot of health checks that take place. It's not just for the health of yourself, but of your baby as well. We provide you with an HIV test and the relevant, baseline assessments, and make sure that, throughout the period of your pregnancy, you are healthy and you deliver a healthy baby as well.
Nichola, it's closer to Valentine's Day. We often see quite a lot of, young people partaking in different activities, doing different things. Let's finally end off on a warning note. What would you say to young people who are looking ahead to this day and they're planning all kinds of activities, all kinds of parties and things that they also, set themselves up as TikTok challenges sometimes?
So, utilize condoms. Please use them correctly. Please use them consistently. We have HIV testing services available. Know your HIV status before you get into a new relationship. Discuss these sexual incidents or acts with your partner. Be open about it and just protect yourself. The condoms are freely available. It's the cornerstone of our HIV and STI prevention program. That is what we say. We know people are going to be engaging in romantic sexual acts. So please utilize a condom. And this is our message to the community in Gauteng.
Thank you so much, Nichola. And I'm glad it was a stable line despite the load shedding. But thank you so much for that. That was Program Manager for STI PrEP and Key Populations at Gauteng Department of Health, Nichola Lutchman.